Our board decided several years ago to include accreditation in our strategic plan, and that was going to be part of one of our long-range goals. So we started with the National Public Health Performance Standards and did the governance instrument, but that was not really very understandable, not very useful. So we got kind of so-so results and weren't too excited. So we waited a while, and now with the Public Health Accreditation Board taking charge of it and all the national public health associations getting behind it, now the ball is rolling nationally, and it seems to have really taken on a life of its own. And we believe now that the standards for accreditation are understandable and achievable, and I think it's going to be a worthwhile effort. Well, I think that people worry because they think it's going to cost a lot of money, it's going to take a lot of staff time, and we're not going to end up with anything. But I think that's just people's resistance to change, and I think the pros definitely outweigh the cons, because I believe that our health department will be living up to a national standard of excellence that can be measured and compared to any place else. And I believe that gives the public and the Public Health Board more confidence in how well our Public Health Department is protecting our health. Well, I was skeptical at first because I thought our health department was doing a great job anyway. Mm-hmm. But what I know about them and what the public knows are different. So we need to raise our profile and let the public know exactly what's being done to protect them. Mm-hmm. So I think this is a good way to broach those topics and to have a more open dialogue with the public.
And it was just a perfect fit, because in our department mission, actually in our stated goals, are education, leadership, and services. So it was just a nice flow, nice segue right into accreditation for the Oneida County Health Department.
Yes, it does involve a lot of time, but I think it's well worth it, because you're proving to yourselves as well as the community and your political leaders and other health departments that yes, you indeed give a high level of service. I believe our staff enjoys the challenge, of proving, hey, politicians, city government, community at large, we really provide extremely high quality of service. And this is our way of, showing it.
I see our health department as much more agile in addressing those three areas again in education, leadership, and services. I see them as forward-thinking and trying to get ready and preparing and having the structure to meet any of the challenges that are coming in the future, whether they be funding or health. It is going to enhance our image within the community, and we are going to be able to assure them that we're providing quality services, that leadership is being developed, that the services are being accountable, that education is an ongoing, integral part of the Oneida County Health Department. So I see that as all positive outcomes of the accreditation. Right now, our accreditation is funded through grants. That, if you think ahead, may be an issue in the future. If those grant possibilities are not there, then we need to figure out how are we going to continue this, because truly as a board member I feel it's an absolute necessity for our health department.
But if we get accreditation, I know I read that grant funds will be more available if you are accredited, and the FAB will help you, with the documentation. Marvelous. But you can then prove to them that yes, indeed, we are striving to provide the best quality of service in the most efficient way possible. And I think then the funding will come, I hope.
We have great confidence in our staff to be able to achieve the goals they need for accreditation. So I think what it's done is it's improved communication between the board and the staff, and it's raised our level of confidence in each other, board to staff and the reverse. And we're very united in terms of achieving a national standard of accreditation.